So now it is my pleasure to introduce you to Dr. Lynn Karoly. Dr. Karoly is a senior economist with the RAND Corporation and a professor at the Pardee RAND Graduate School. The school is the largest public policy PhD program in the nation, combining analytical rigor with practical experience. So working with RAND for more than 2 decades, Dr. Karoly's research has examined human capital investments, social welfare policy, child and family well-being, and labor markets. Her professional service includes serving as the 2017 president of the Society for Benefit Cost Analysis and prior editorial roles for the Journal of Benefit Cost Analysis and the Journal of Human Resources. Dr. Karoly received her PhD in economics from Yale University, and please give a warm welcome to New Hampshire to Dr. Lynn Karoly.
Good morning, everyone. It's a real pleasure to be here. Despite the snow, I'm glad I came in a couple days ago, so I missed this storm, and I'm leaving after or before the next one arrives. So I've really enjoyed my time here in doing this work. So in looking at these issues around early childhood, I wanted to identify several challenges that I think are before the state. When I first looked at some of the data for New Hampshire, I said, wow, the poverty rate's relatively low here in New Hampshire compared to other states. But I think it's important to recognize 2 things. One is that poverty rate has been rising. So the population that's officially defined as being poor, which is about 12% of the children in the state, has been growing over time. Moreover, when we look at the population that's at risk of the kinds of toxic stress and other risk factors that you heard Jackie talk about, that definition of who's officially poor really misses the mark. There are many more children who face risks in early childhood that can compromise their healthy development. When we think about these issues in early childhood, they also have implications both for today's workforce and for the future workforce. In New Hampshire, when we look at children before they enter kindergarten, 70% of the children less than kindergarten entry age have all available parents in the labor market. In other words, a single-parent family, that parent is working. In a 2-parent family, both parents are working. So for many families, access to high-quality, reliable childcare and early learning programs is critical for them to be able to work. And that's especially important in a state like New Hampshire with one of the lowest unemployment rates in the country. Likewise, as you heard, today's children are the future workforce. So in thinking about the opportunities that children have in these early years to grow and develop in a healthy way is critical for thinking about the future of the state and where the state's going to be in its economy in the decades ahead. At the same time, we know that there are resource constraints, so that when you're looking at investments in early childhood, it's important to understand what will be the return from those investments, because there are plenty of other opportunities for ways in which resources can be spent. So it's important to have that information in making these decisions about where to invest in children's futures. So the study that we undertook basically asked the 3 questions that are listed on the left hand of this chart. Is there a need for investment in early childhood in New Hampshire, particularly for at-risk children? What is the evidence regarding the costs and benefits of alternative strategies for investing in early childhood? And I'm going to be talking about options for investing that begin prenatally or soon after birth all the way until kindergarten entry. And what would be the expected return to New Hampshire from making those investments? And you can see on the right-hand side a short list of the key findings that I'm going to walk you through in the time that I have this morning. So I'm going to begin with that first question. Is there a need to invest in early childhood, particularly for at-risk children? And I think you'll find the information that we've put together compelling in terms of why there is a need to make further investments in these early years. In New Hampshire, about 70,000 children are between birth and kindergarten entry. Of those children, I mentioned a moment ago, 12% would be classified as poor based upon the U.S. federal poverty line. But as I indicated, that measure of who has limited resources misses the mark. And that's because the official poverty line, for example, I'm showing at the bottom of the slide, for a family with 2 adults and 2 children as of 2015 was about $24,000. In New Hampshire, we know from looking at the cost of living that a family would actually need something more like 3 times that level of income in order to be self-sufficient. In other words, in order to be able to meet their needs for housing, food, childcare, health insurance, and so on. And so when we look at the children who fall under that threshold of 3 times the federal poverty line, we're talking about 45% of those children before they enter kindergarten in the state would be in families with low resources based upon that indicator. These are families who can't afford access to high-quality childcare, high-quality early learning programs. And in many cases, these children face the kinds of risks that you heard Jackie talk about. Another way to look at who's at risk is to look at the fact that many of these risk factors are present from birth. And this chart indicates a number of different metrics of children who are at risk for healthy development starting from birth. They include children who have low birth weight, where the mother is a teenager, the family otherwise has low resources, low education of the parent, and so on. And you can see at a minimum up to 1 in 3 children face these kinds of risks. And in many cases, these risks are compounded. There are multiple risks at play. So one of the things we did as part of our study was to look at what resources are already in New Hampshire to support children and families in these early years. And this chart lists a number of the key programs, the major funding streams. Some of these you will have heard of, such as Early Head Start and Head Start. There's a home visiting program that's supported largely with federal funds. Federal Title I funding comes to school districts that have high poverty populations. There's also some local school district investment in preschool, largely for special education students, again with federal funding. And there's federal and state funding that goes to support access to childcare from birth to age 12. Across these funding streams, a couple things you'll notice. One is that it's largely federal resources that are supporting these investments in early childhood, some state money. But the most important thing is that when we look at these resources, yes, they lay an important foundation and they provide a base from which to build, but these programs were never funded at the levels required to meet the need that exists in New Hampshire, and this is really true across the country. And just to illustrate that, the Early Head Start program and the Head Start program target families with income below poverty. And on this chart on the left-hand side, it shows the percentage of children either who would be eligible for Early Head Start or Head Start, those in the poverty population, that can be reached by these programs given their current funding levels. In the case of Early Head Start, funded at a very low level across the country, it's reaching about 7% of the infants and toddlers in the state with family income below poverty level. Head Start has somewhat higher funding, so it's reaching about 39% of those children. But again, neither of these programs with the federal funding that exists are funded to reach all of those who are potentially eligible. Likewise, when we look at the child care scholarship program, so this is subsidized child care in the state, which is available to families with income up to 250% or 2.5 times the poverty line, closer to that level of self-sufficiency that I talked about. Again, that program is only reaching about 13% of infants and toddlers and 22% of 3- and 4-year-olds. So again, these programs are there, but they're not reaching all of those who could potentially benefit. One consequence of that is that when we look at data in terms of who participates, for example, in preschool, so these are figures for 4-year-olds in the state of New Hampshire, arrayed by family income. The left bar is those whose family income is below poverty, 1 to 2 times the level of poverty, 2 to 3 times, and then more than 3 times the level of poverty. So that far bar is the group of families that exceed that marker of self-sufficiency. Those are families who could potentially afford to have their child in a preschool program. And you can see they do so at a rate of 80%. So 4 out of 5 children with income in that bracket are participating in preschool. We'll compare that to what that looks like for the lower income children. And you can see that there's a steady, strong relationship between income and who's participating in these kinds of preschool programs. Now, I can't say much about the quality in these different settings that children may be in, but just the fact of who's participating, you see this sharp difference by family income. One consequence of that is differences in how students perform in school. And so this is a long-standing issue throughout the country, that we see diminished performance in the education system for children who are economically disadvantaged. This essentially picks up a group in the blue bars whose family income is about 1.85 times the poverty level, so somewhere around 2 times the poverty level. In New Hampshire, these are data specific to New Hampshire, according to a national assessment of students' proficiency at both 4th and 8th grade. You can see a contrast in the percentage who are measured as being proficient in either reading at 4th grade or reading at 8th grade, a sharp difference in that proportion, 20 to 30 percentage point difference between those who are economically disadvantaged, performing at a lower level of proficiency, compared to their peers who are in the economically advantaged group. And that economically advantaged group, in many cases, aren't all that advantaged. It just means that they have more than 1.85 times the poverty level. When we look at the 4-year graduation rate here in New Hampshire, those children who are classified as economically disadvantaged, 77% of them graduate on time from high school in 4 years, compared to 93% of those in the higher income group. And again, if I could really break this out by finer gradations of income, you would see, again, that strong relationship that those who have lower income are performing at lower levels throughout their schooling years. And that lower graduation rate, that's your future workforce. And that's about 1/3 of the population in the education system. So 1/3 of the future workforce is less likely to be graduating from high school. And also, as they go through school, they're probably acquiring less skills as measured by these indicators of proficiency. So a second component of our study was to say, well, given this need, what do we know about programs that can work across this continuum from even starting prenatally until children enter school? And we focus on evidence that we refer to as rigorous, which means these programs have been evaluated with scientifically sound methods to know that what we're measuring are the true effects of the program and not some other factors. And I'm going to focus on evidence around 2 different types of intervention strategies. One is home visiting. So there's a long history of using home visiting as a mechanism to work with families at risk, starting prenatally and continuing through the first few years of life. In New Hampshire, there's a program that's being implemented now along with a number of other home visiting models called Healthy Families America. It's an evidence-based program. The funding from the federal government requires the use of an evidence-based program. And throughout New Hampshire, that program focuses on populations that have been targeted based upon the need in the community, and the set of services are designed to meet those needs. That program, as evaluated in other parts of the country, has a strong evidence base, and it's had follow-up through age 7 of the participating children in some of these programs. Another model that we look at is referred to the Nurse-Family Partnership Program. It uses nurses as the home visitors. It's actually a program that was implemented at one point in New Hampshire. It targets a population of first-time mothers with low income. It also has a strong evidence base from randomized control trials in different parts of the country. And one advantage for this study is that they followed participants in one of those evaluations to age 19. So we know something about the longer-term effects, both for the mother in the program and her child. And as a result of that longer-term evidence, there's some studies that have shown economic returns. Some work we did all the way back in 1998 looked at the returns to the program, and more recent evidence indicating that returns can be as high as 6-to-1 for investments in that program. Another strategy we look at is high-quality preschool. This is an area that when I first started working in this area about 20 years ago, we mostly had evidence from small-scale model programs. And what's quite striking today is more and more states and even school districts have invested in high-quality preschool programs and evaluated them. We now see that these programs work when scaled up and implemented with public funding, just as you might do here in New Hampshire. These programs both serve more targeted populations, such as families with children in poverty, as well as some programs like Oklahoma's preschool program is universal. All 4-year-olds are eligible to participate in the program in Oklahoma. This is investments that states are making, both red states and blue states, recognizing the returns. And again, the costs can be something that some might balk at, but given the evidence of return, we know that this can be also a worthwhile investment. So based upon that evidence, we undertook an analysis to look at New Hampshire, given the population at risk, the underlying base of funding in the state. What would we expect to see in New Hampshire from further investments in early childhood programs? And again, we focus in particular using the nurse-family partnership model as a home visiting model because of its evidence base, and then secondly, at a 1-year high-quality preschool program. And in both cases, we find evidence that based upon our analyses, a range of assumptions, that these programs would produce positive returns for the state of New Hampshire. So let me say a little bit about that part of the analysis. So we know from making these kinds of investments in early childhood that they affect a range of outcomes, the rows here in this table. By affecting those outcomes, it generates benefits in a variety of ways. It can reduce the spending on the part of the public sector for the education system, but also subsequent when people reach adulthood, lower costs for crime, lower costs for the social welfare system, as well as higher taxes paid because of the greater improved educational outcomes. Those generate benefits for the public sector, the participants themselves can benefit, and when we have reductions, for example, in crime, the rest of society benefits because of the reduced crime levels. So as an economist, we take all of those components and place economic values on them and add them up and compare them to the program costs. So essentially, this is the calculus that we do. We have the program costs for New Hampshire. We've estimated those costs specific to implementing a program in New Hampshire, and then in accounting for the benefits where we can, it's also specific to New Hampshire. In some cases, we use national estimates. But the bottom line we ask is, does this program generate benefits that exceed the cost? Or we can also calculate the benefit-cost ratio, which is the ratio of benefits to costs. In the case of the nurse home visiting program that I mentioned, this would be a voluntary program. We view it as one that would start at a small scale because there can be issues with having the qualified workforce in place. So we assume a program that would reach 100 mothers, first-time mothers with low income. And the program, based on the cost of those services for this program that has been replicated throughout the country, would be about $5,000 per year for family. Typically, families participate closer to 2 years, so the cost is about a little more than $8,000 per family. And our baseline assumption, just to be conservative, is that this program, if implemented in New Hampshire, would be 80% as effective as it's been in implementing it in other parts of the country. So that's a conservative assumption. We also allow for the possibility that it could be more effective, so equally effective as programs implemented elsewhere, and also adopt an even more conservative assumption of 60% effective. And this is a way to say that even if the program doesn't do as well as it's done in other parts of the country, would you still see a positive return. So this chart now shows you in red bars the cost of the program under that range of assumptions from the most conservative to the less conservative assumptions. My baseline is there in the middle. So the red bars are the cost per family served, and the green bars are the sum of all those economic values associated with the benefits from the program. For those of you who do this kind of analysis, all dollars are represented in today's dollars, even though they may occur in the future using a 3% discount rate. And you can see here that the ratio of benefits to costs is anywhere from $4 to $6 for every dollar invested, which is indeed a very positive rate of return for investing in this kind of high-quality program. In the case of the preschool program, what we model for New Hampshire is a 1-year program that would be available to 4-year-olds in the state. We assume a targeted program, so we specify that this program would be available for those families for whom current participation is not up to that level for higher income families. So it's available, we assume, for families up to 3 times the poverty level. We assume that this program follows high-quality models that have been implemented in other parts of the country, such as Oklahoma's high-quality program. Boston has an excellent program that's demonstrated strong benefits. And by our estimates, implementing that program in New Hampshire with a qualified teaching staff, which would be bachelor's levels teachers, with pay parity with the public education system, although this program could be implemented both in public schools as well as in community-based providers, Head Start programs, community child care providers. That cost would be about $9,300 per year for a school year program. And again, we have a baseline assumption of 80% effectiveness and that range of assumptions from 60% to 100% effectiveness. And here's what you see for those results, looking again at all children who would have income up to 3 times the poverty level. We see estimated returns from a little under $2 on up to the higher returns closer to $3 per child. We also look at results if this program were even more targeted. Say you started with children whose family income was below poverty. And because that population has even greater risks, greater need, the returns would be estimated to be as high as $4 for every dollar invested. And this is typically what we see, the differences between very targeted programs and programs that are reaching a broader population, but where we know the need is still there. Go back one. So the bottom line is that indeed in New Hampshire, there are opportunities to invest further in the young children in the state, particularly those most at risk of the various kinds of factors that you heard Jackie talk about, that will compromise their development, mean they're entering school less ready to learn and likely to stay behind as they continue through school, less likely to graduate from high school, and the associated impacts that has for the rest of their lives. We know that there are high-quality programs that can be implemented in early childhood that will make a difference, and specifically when we look to New Hampshire and model what it would look like to implement 2 of the evidence-based strategies, we see that there are indeed positive returns for the state. Just to say a few words by way of conclusion, we think it's important to think about these investments in terms of a portfolio. We wouldn't necessarily argue that you would only do one of these strategies, only do early home visiting, only do a high-quality preschool program. Children face risks throughout this period, and there are different ways in which those risks can be addressed, and it's important to think about the state's investments in this area in terms of that portfolio. Most importantly, though, it's important that those programs are high quality. We know that when programs are implemented with lesser quality, we don't see the kinds of impacts that the best programs can produce. It's also important that these programs in early childhood are aligned with what happens in the early elementary grades and on through the school years, and that it's important to monitor and evaluate what is implemented to see that you're achieving the results. And part of supporting that kind of ongoing monitoring and evaluation is having good data systems in place. One of the challenges we had with this study was that all the data we would have liked to have wasn't necessarily there because of existing systems. So again, here are the opportunities for New Hampshire, and I look forward to hearing the discussion that will follow.